Good day. Again, I'm Dr. Mapua and I'm here to discuss about COVID and breastfeeding. Here are my objectives. I know we are very familiar with this disease, but just for a brief review, COVID-19 is a disease caused by a virus called SARS-CoV-2, which first appeared in late 2019 and quickly spread around the world. People with COVID-19 can have fever, cough, trouble breathing, and other symptoms. It spreads from person to person by a respiratory droplet when an infected person coughs, sneezes, or talks near each other. The incubation period of COVID-19 is from 2 to 14 days. So let's answer questions regarding COVID-19 and breastfeeding. So first question, can COVID-19 virus be transmitted through breast milk? A collaborative study done among researchers from 5 hospitals like Brigham and Women's Hospital and Harvard Medical School to name a few, involving 37 breast milk samples from 18 mothers diagnosed with COVID-19, showed that none of the samples contained the virus and two-thirds of contained antibodies to COVID-19. So currently, COVID-19 cannot be transmitted via breast milk. Question number 2. Can a mother breastfeed her baby if she has COVID? According to WHO, mothers with suspected or confirmed COVID-19 should be encouraged to initiate or continue to breastfeed. Mothers should be counseled that the benefits of breastfeeding substantially outweigh the potential risks for transmission. So third question, can a COVID positive mother sleep with her baby? Again, according to WHO, mother and infant should be enabled to remain together while rooming in throughout the day and night and to practice skin-to-skin contact, including kangaroo mother care, especially immediately after birth and during establishment of breastfeeding, whether they or their infants have suspected or confirmed COVID-19. So how can the risk be managed if a woman with COVID-19 can breastfeed? If they wish to do so, they should practice respiratory hygiene by wearing a mask, washing hands before and after touching the baby, and routinely cleaning and disinfecting surfaces. So, if a woman with COVID-19 is unable to directly breastfeed, she can be supported to safely provide her baby with breast milk in other ways, like expressing milk, relactation, or getting breast milk from the milk bank. So, next question, is EINC done for COVID suspect or confirmed mother? So, pre-COVID unstable mother or baby, they're separated. If the mother is asymptomatic or with mild symptoms, she's given an informed choice prior to giving birth between separation or non-separation of the baby. So, both choices are explained to her. If a mother prefers non-separation after informed choice, the EINC protocols are done with strictly observing infection prevention and control measures. The only difference is that the baby is placed in the bassinet at least 1 meter or 3 feet away from mother's bed. The mother should be able to observe her baby and exercise fall precautions. She can get her baby during breastfeeding, wearing mask, and observing hand hygiene. How about if mother prefers separation after informed choice? So after the baby is delivered, he or she will be dried immediately and thoroughly, do properly timed cord clamping at least 1 minute after birth, and implement separation. Alternate caregiver is advised on infection prevention control and infant feeding options. So babies and the isolation area should be at least 1 meter or 3 feet away from each other, exercising fall precautions. They should not wear face mask or face shield. So separation can be discontinued as follows until RT-PCR swab test results for mother and baby are concordant, or until 14 days from resolution of symptoms of mother, or until 14 days from last significant exposure of mother. How about COVID vaccine? Can a breastfeeding mom receive it? The Philippine Pediatric Society released a statement which says that it supports the statement of the Philippine Obstetrical and Gynecologic Society on COVID vaccination of pregnant and breastfeeding women. But it's reiterating that all COVID vaccines may be offered to breastfeeding women after consultation with their physicians and after shared decision making. Breastfeeding women who are classified to be in the high risk group, like the health workers, are recommended to receive the vaccine. Breastfeeding women should not be withheld from receiving COVID-19 vaccines who otherwise meet criteria for vaccination. There is no need to avoid initiation or discontinuation of breastfeeding in patients who receive a COVID-19 vaccine. So that's all. Thank you for listening.